Hello everyone and welcome to Health and Family. I'm Shay Dawn Burgess. Today we're talking about a relatively new benefit offered to FutureCare and H.I.P policyholders. The benefit is called the Personal Home Care Benefit, and it assists FutureCare and H.I.P policyholders with the cost of home health care. This means you can stay in your own home instead of a hospital or other facility as you recover from an illness or an injury or have increased needs related to aging. My guest today is Miss Diana Liakos. She is the Clinical Care Manager with the Health Insurance Department. The Health Insurance Department oversees FutureCare and the Health Insurance Plan. She will be speaking about who can claim the Personal Home Care Benefit. We welcome you to Health and Family, Miss Liakos.
Thank you.
So let's start off with talking about what FutureCare and the Health Insurance Plan looks like in case some viewers may not know. We can start off with that.
The health insurance plan is for persons between 18 and 64. It's a basic health insurance package, and the FutureCare is for those over 65, giving a little bit more robust of a basic package for health care.
So the benefit we're talking about today is the Personal Home Care Benefit, and this is available to both FutureCare and H.I.P policyholders?
Yes.
Okay.
Yes.
And so is this benefit also offered through private insurance?
No, it hasn't yet been offered by private insurance.
So why was it initially even created?
Because we saw that a lot of the persons with our policies were staying in hospital for longer periods of time because they didn't have assistance in the home for really basic care related to their personal care needs for the everyday living. And we also saw that there were some individuals that, because there wasn't any assistance in the home, that there wasn't they were going into a residential home sooner than would have happened in other jurisdictions.
And so they may not have been necessarily well enough to be at home by themselves.
But with a little bit of assistance, they could have stayed in their own home.
Okay, that makes sense. And it's more comfortable for the person, I would think, to be in their own home. Absolutely. So can you give me 3 circumstances of someone who might utilize this benefit?
So if someone becomes acutely ill and has a different change in their abilities because of that illness or condition. So for instance, someone with a stroke would have that event and then need some additional assistance with their mobility or with their bathing or toileting even when they got back home for them to be able to manage again at home.
What are the requirements to be eligible for this benefit?
You have to have a policy with us for a year, and then you need to have 2 or more functional impairments, which are related to your ability to care for yourself on a daily basis, or if one of them could be that you have dementia.
All right. And so as far as it says here too that you need a person, am I going to be the one, say for instance it's me or my mother or father, am I going to be the one that's able to hire that individual to assist?
Yes.
Okay.
Yes.
And so they would be the care provider for whoever the care needed to be for. Okay. And so does the doctor have to refer that person, or?
No, actually the policyholder themselves can put in a request for the benefit, or someone in their family can put a request in. Sometimes we have the social workers in the hospital talk with the family, and then they'll put the request in together. So it doesn't require a doctor's. We do require a doctor's letter regarding the person's health condition as part of the process, but to put the request in can be.
All right, so I'm going to need to get a form. Talk to us about the form and what it entails.
It's a basic form. It's called a request for the benefit, for the personal home care benefit, and it just gives us the information about the policyholder, their name and address and contact information.
Just
the
basic
family,
information.
right?
Okay. And so what do you mean by a functional impairment?
So that's related to your ability to care for yourself. So anything that gets in the way of you being able to function on a day-to-day basis. So what people think of mostly are things like being able to get yourself up out of a chair for walking, for instance, to be able to give yourself a shower, get yourself dressed, getting yourself to and from medical appointments. Those are
So they'll be providing the driving as well and things of that nature.
sometimes.
Okay. What is the maximum that a benefit will pay a caregiver in a calendar year?
All of the benefits together could allow a benefit up to $60,000 per year.
Really?
There's several different levels of benefits related to what kind of care you need.
Could we go into that a little?
Sure. So personal caregiving is related to helping the person with those activities of daily living,
Right.
dressing and grooming and bathing, hygiene, toileting, moving, eating, or meal preparation. And so that would be a personal caregiver.
Okay.
Sometimes people have health conditions that require a little more skill set, so they may need to have a certified geriatric aide or a certified nursing associate providing the care because of some underlying health conditions.
Right.
So that's the skilled caregiver. We have registered nurse visits that people can have 12 additional visits. Now, FutureCare policyholders already have 12 visits on their policy, but this allows an additional 12.
Okay.
So if they need nursing visits, registered nurse visits for monitoring their respiratory function or their cardiac function, for instance. So for someone with asthma or chronic lung disease, that might be something that they need. There might be someone who has a very complicated wound that needs dressings frequently, and that might be something that a registered nurse would provide. The other additional piece is the registered nurse can help with supervising the nurse associate if that's there, and also with planning out what sort of care the person may require.
Okay. So does this include housekeeping and cooking?
It does not. It's not the benefit. It will not cover housekeeping
Per se. Okay.
But if someone requires support, so that for the meals, for instance, to help prepare their meals because they can't do it themselves because of limited mobility. Like we have some clients who have significant arthritis in their hands, and that gets in their way of them being able to get their own food ready for themselves. They can feed themselves once it's put together, but they just don't have the dexterity to do all of it themselves. So in that case, the personal caregiver would be able to help with that.
So how does a person get approved for this measure?
Once they've put in a request for the benefit, there's other nurse case managers in our office besides myself, and one of us will contact the family and set up an appointment to do a home assessment. We do a nursing assessment at that point and talk about what they need for care. If the person's in hospital and the family's looking to get some additional help to get them back home, then we'll go to the hospital. We'll make arrangements to go to the hospital to see them.
The assessment takes place at the hospital?
For those people that are in hospital, so if they've had an acute event and now need support in the home, yes.
And so I'm thinking of a person that has steps in their house. Would that be part of your assessment of the home? And things
We look at the steps, we look at the shower or tub arrangements for safety reasons, the toilet, even just are there any tripping hazards in the house, or are there any environmental hazards in relation to their respiratory status, if they have a respiratory condition. We review their medications. And
is this just for a person that lives by themselves, or could they live with a family member?
Sure, they could live with someone else. It's really just it was put in place to keep to keep people who might need additional care in the home and to support families who would like to help their loved ones stay at home. Generally, most people they have a much higher quality of life and a more dignified life if they can stay in their own home versus moving into a facility.
Yes, I agree
So
with that.
that's what we want.
So what is a care plan per se? What does that look like, a care plan for the individual?
A care plan will be approval of the different types of care that someone may require and how many hours we project that someone may need. We do it in collaboration with the family and the person to determine what it is they need assistance with to help plan it out. We also will make recommendations for referrals to community nursing if they need a lot of nursing support, for instance, or if they need community physical therapists to come in to help with sort of helping the person getting their balance and mobility to a higher level of functioning.
This would also include an occupational therapist or something?
Right.
Yes.
Community nursing can offer physical therapy or occupational therapy. Sometimes we make a referral to Action on Alzheimer's to help with getting the family more familiar with dementia or Alzheimer. And also we've worked in collaboration with them in training the caregivers, the family or the caregivers or both, in terms of how to best approach a person with dementia, so that it's easier for everyone involved.
So the policy holder is he or she responsible for any additional cost other than what's on the policy plan? How does that work?
So our benefits have maximums for personal caregiving, we have an hourly rate of $15 per hour, and we have a maximum of 40 hours per week. For instance, so if they were to hire someone that charged more than $15 per hour, they would be responsible for the remainder.
Oh, gotcha, covered. So if the individual is saying, well, I actually charge $18 an hour, then the policyholder would be responsible for the additional $3
an hour.
Okay.
Yes.
How will the policy find out if he or she is approved? How does that work out?
Once we usually tell most policyholders will tell them right at the time we're doing the nursing assessment that we're going to approve them, and then we'll get in touch with them in a day or two with the exact amounts of care hours that they're approved for.
Okay. And so the norm is usually 40 hours per week?
It really varies. We also cover daycare
At a different facility?
At a facility,
Okay.
right. So we may recommend, most of the time we're recommending a combination of some personal care hours, for instance, to help the person get up, get bathed, have breakfast in the morning, and get dressed, and then some daycare hours so they can go to a daycare program. Because that's very important for people, especially for people living alone, because people do better if they have some social and recreational activities. And if you're isolated all the time, that's very difficult on you emotionally. But also, it doesn't help you maintain your functioning very well. It's better for you to get up and get moving and be socializing and talking to people.
So as far as any other additional requirements from the health insurance department, what else? Are they supposed to be registered with another agency so that they can apply to you guys, or how does that work?
The caregivers themselves would need to register with Aging and Disability Services,
The
which
caregiver.
is the caregivers register. There's a registration process through Aging and Disability in the Ministry of Health for the caregiver.
It sounds like it's more jobs that are going to be made available, right? Because they would have to. Good. That sounds good.
It does actually. We're hoping that it expands the community's availability and then the access for people to have more care in their own home.
Okay. And so how do we define a responsible person? If you could just quickly do that, and then we're going to take a break. As far as to make the decisions for the individual that needs to be cared for.
Okay, so for persons that have dementia or other mental impairments so that they can't make their own decisions, we ask for them to have a responsible person, which can be anyone, a family or a relative, that is designated to be in charge of hiring the caregiver and overseeing the caregiver to be sure that the person getting the care is getting what they actually require.
Okay. We're going to take a break right now. We'll be right back. You've been watching Health and Family. Stay tuned.
Healthy people in healthy communities.
The barriers people with disabilities face begin with people's attitudes. Disability is only one part of the person. Look beyond the disability and see someone who goes to work, has a family, does laundry, gets angry, cries, laughs, and dreams like everyone else. Awareness, the first step towards change. This is a message from the Department of Health.
Hello, once again. Welcome back to Health and Family. We're talking with Ms. Diana Liakos about the benefits of this new, basically a new policy, new home care benefit. All right. So what I wanted us to recap about the requirements that one would need to be eligible for this benefit. I know you mentioned it a little earlier on, but just go on a little bit about that so that we're all on the same page with that.
Okay, sure. So a policyholder would have to have a continuous policy for 12 months to be considered for the benefit. They would need to have 2 or more functional impairments, their ability to take care of themselves on daily living skills, or they have, one of the functional impairments can be that they have dementia.
Okay.
They would need to agree to have nursing case management with us.
So you're saying if a person has dementia, that they would need to have another impairment, or that would be sufficient?
Yes.
They would need to have
No,
2.
they need to have 2.
Okay, so dementia would be
so
one.
dementia plus
Something else.
something
Okay,
else,
okay.
like needing some assistance with their self-care.
Okay. Okay. Because dementia is quite big.
Yes,
Yeah.
it is, yes.
All righty.
So they would have to be willing to participate in ongoing nursing case management, which is with us, the nurse case managers in the health insurance department.
Okay.
And most of the clients that we've had do that, they actually think it's terrific because we give them recommendations or advice about how to keep moving, how to stay healthy,
Yes.
for families, how to keep their seniors safe, and avoid accidents or falls. That's the nature of it, really. Sometimes we help with getting conversations going between physicians and the policyholder to help manage their healthcare issues a little bit better if they have concerns about what's going on. And the persons with dementia can still have access to this benefit as long as they have some other person in the family that's willing to act on their behalf and hire a caregiver,
Okay.
and then also to help oversee what the caregiver is doing.
And so that person actually becomes sort of an advocate and like I'm thinking of the word, the legal term. Can't think of that right now.
So we've called it the responsible person.
Oh, okay.
But
Sounds good. Nice and easy, yes.
it's not the legal term.
That's fine, that's fine.
But that's what that means. But the responsible person can be anybody in the family. It can also be a
Good
friend.
okay.
We have one lady where it's she had a person from her church that had been helping her a lot and decided to take on the role to be her responsible person.
Okay. So how many people are currently enjoying this benefit? Because I think it's a great benefit, I really do. And I'm glad you're on so we can get the news out there. But how many people are actually enjoying this?
It's a little over 200
Okay.
that we have right now.
And what's the feedback been thus far?
It's been great. We have one family where the daughter was really feeling stressed out because her mom was getting her mom is in her late 80s. Yes. And was really having difficulty being home alone and managing for herself all day long. And the daughter wanted to retire but couldn't afford it so that she could stay home and take care of her mom. And when we started this benefit, she was very happy that we were able to give her some assistance. She became the personal caregiver herself. Yes. So family members can go through the registration process to be a caregiver. And she was able to cut back on her work hours because now she could afford it because she had a little bit of financial
So she had
support from
maybe
the benefit
oh,
to care for her mom. So she cared for her mom directly.
and that was she was a caregiver position. Okay. Go ahead. I'm sorry.
No, so that's one instance I think that can be very beneficial
Yes, yes, yes.
for those. And the benefit's not, although most of our clients are seniors, it is also for people with disabilities
Yes.
related to their health conditions. So there are some younger people who have benefited as well.
Okay.
And again, the family, if someone in the family wants to step up to be the caregiver, but couldn't have afforded it otherwise, because then they wouldn't be able to have ends meet
Right.
with
Now,
with their
this
own
policy. Yeah.
right, then maybe this will help them out.
Okay. And so when this initiative started when?
In September of 2015.
Very good. I never actually heard of it.
Yeah, so a little over a year ago.
Okay. Any final words you want to give us as to how an individual can apply? Once again, just to make sure that they have all their paperwork in order.
Yeah,
And
it's very simple, and we'll talk policyholders through the process if they're interested or they think that they may qualify. It's one simple form, the request for benefit form. It's available on our website or it's available through our office.
if the website would be
The website is HID at gov.bm.
HID.
D, right, Health Insurance Department.
Okay. Good question was about, you have here about the war veterans. If someone's receiving that, will they still be able to apply for this benefit?
When we started this benefit, we started collaborative meetings with the Department of Social Service for war veterans and also Department of Financial Assistance for those clients that may have been receiving the home care benefit under those two agencies, because they have their own home care benefits, war vets and financial assistance. So we became first payer, but they will continue to cover services if it exceeds our benefit.
Okay. Will be like the supplementary
So
income?
They won't. So if you hire someone above what we pay for an hourly rate, they're not going to compensate for the copay. But if you require more care, so our personal caregiving benefit has 40 hours per week. But if you require 60 hours per week, then they'll pick up the additional 20 hours per week.
Okay, but you would be the initial payment.
Right, and it's actually, we've streamlined the process for the claims. The caregiver would submit the claim to us, so it's all the claims go to one department instead of three. So they would all come through the health insurance department, and we would pay first, and then we would send the remainder claim to the appropriate department, war vets or financial assistance.
So as far as do you come and check and see what's going on periodically to see if everything's on the up and up?
We do a lot of telephone follow-up with checking in with the family to be sure that things are going okay in terms of finding a caregiver, hiring a caregiver. We give the families a sample template of a contract that they could have with a caregiver, which specifies all the care tasks that someone might require. So we've helped them fill that out sometimes if they need that. It's a good tool to just be sure that they are clear in what they're paying the caregiver for and what the benefits reimbursing the caregiver for. We have gone. We'll do follow-up home visits for people that require that as well.
So say, for instance, that a person, for whatever reason, can only have maybe two caregivers, 20 hours per week. Would that work? Or that would
You
work
can
as long
have,
as,
right. It could be any combination of
as long as
caregivers.
it does not exceed 40 hours
Right.
per
So
week.
if you need to have 4 or 5 caregivers to give you that 40 hours of assistance, that's fine, as long as those caregivers go through the registration process.
And they need to have taken some type of course themselves, the caregivers, I would think?
Yes, so the registration is through Aging and Disability Services,
Okay.
and they are required to have CPR and first aid training.
Great.
They are also required to have a police vetting. Again, just we're we're hoping to protect seniors in that
Yes.
regard. If it's for skilled caregiving, they're required to have a certified nurse associate license. If it's a registered nurse, they need a registered nurse.
And you
If the
check
day-
up on that. Yes, you verify
That's part
that.
of the
vetting.
registration,
Right, okay.
vetting, yes.
Okay.
And the daycares need to be registered and approved daycares within the residential home that is licensed, registered, not licensed, registered through Aging and Disability Services.
It sounds like it's a great plan, and as you said, it's so far the rollout's been pretty good in your estimation. All right, well, we're going to actually finish our interview, but if there's anything you want to let us know, please, this would be the time.
I think if people have questions about the benefit or they just want to talk about the benefit, we're always available. Our customer service representatives in our office are able to give them the basic information, and if there's more questions regarding health issues, they'll refer the phone calls or the inquiries to myself or one of my other nurses.
Thank you so much. A lot of information,
Thank
Miss Diana Liakos. And we also want to thank you all for watching Health and Family and learning about personal home care benefit. For more information, please contact the Health Insurance Department at the number or email seen on your screen. We'll see you next time. Thanks for joining us. Bye-bye.